Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, if you see the diagnosis of Boerhaave's syndrome, now, fine. For the diagnosis of Boerhaave's syndrome, right, a patient with Boerhaave syndrome, if you do a chest X-ray, obviously the patient will have air present in the mediastinum, air present in the thorax, that is pleural cavity. So on chest X-ray, we can see presence of hydropneumothorax, where there is presence of air, and the effusion, that is liquid, is also seen in the pleural cavity, thus presenting as hydropneumothorax. But actually, for confirmation of diagnosis, we should do a contrast esophagogram will confirm the diagnosis of Boerhaave's syndrome. This contrast esophagogram will actually demonstrate the extravasation in 90% of the cases. It will demonstrate the extravasation in 90% of the cases. Then, fine. For the demonstration, for contrast esophagogram, we can either use a gastrographin water soluble dye is actually preferred to prevent extravasation of barium into the esophagus, into the pleura. So actually, water soluble gastrographin dye is preferred, because if the barium enters the mediastinum, if the barium enters the mediastinum or the pleura, then it can cause mediastinitis, and pleuritis has the complication. So to prevent that, we use gastrographin dye can be used first. And after gastrographin dye, in the gastrographin dye, if no leak is seen, in the gastrographin dye study, then you will have to do a barium swallow can be done. So first we do a gastrographin or water soluble dye is done, mainly to prevent barium extravasating into the mediastina or pleura if there is a perforation. If there is no leak of the dye, that means there is no perforation properly, or perforation has been closed. So in such cases, barium study can be done. Chest CT is also done. When you do a chest CT, you will see the presence of mediastinal air and fluid is seen at the site of perforation. Endoscopy can be done. In the endoscopy, esophagogram is negative or operation intervention. If operation intervention is planned, or if the esophagogram or contrast esophagogram is found to be negative, in such cases we can do endoscopy in the patient.
thank you and thank you for watching.